All right, let's just go ahead and get started. We have about 40 people logged in, and it looks like the number is still going up. So I'm just gonna give a little bit of an introduction, and that'll give people a little more time to join. But I am Dr. Tano. I'm one of the primary care physicians at Rockville Internal Medicine, and I am coordinating these webinars. So I'm hoping that you guys are enjoying the content. For those of you who have seen other webinars or are planning to log in. So just as a little, so today obviously we have a great talk, and I'll introduce our speakers in a moment. But Friday, Dr. Kathy Kemper, nurse practitioner Kathy Kemper-Deem is going to talk about starting a home exercise program. So it's going to be focused a little bit on two different groups. One are the beginners who are haven't done much exercise and want to get started. This is the time. Or for those who are a little more, usually have a routine and their gyms are closed, for example, and are trying to figure out what to do at home. So that should be a great chat too. Kathy is extremely interactive, so I think it'll be a nice discussion. And then next week, we don't have anything. The emails have not gone out because nothing is in stone yet, but we are thinking we might have a talk from one of our dermatologists, and then possibly Dr. McConnell, who's one of our sleep doctors. So stay tuned for that email with the exact dates and times and everything that happens, but we're trying to get a good variety of content. And then I know a lot of you guys are anxious about COVID. We will be doing another COVID update the first week of May with Dr. Tannenholtz and Christina Schrack, who's one of our nurse practitioners. So stay tuned for those emails, look out for them. But today we have two wonderful speakers, Lori Shell, Lori, want to just wave? I guess they can see your. But Lori is our dietitian. She's a registered dietitian at the practice. She's available for individual consults, virtual visits, and she's going to talk about some of the nuts and bolts of using nutrition as a way to eat healthy and focus on weight loss. And then she is accompanied by Dr. Stephanie Park, who's one of our clinical psychologists, who is going to talk a little bit about some of the decision-making that goes behind eating habits. So I think together this will be a nice conversation. And there's one more thing I want to say. Oh yes. So they're gonna go through some slides, but at the end of the conversation, we'll have hopefully ample time for questions and answers from you guys. So as you can see, reminder, there's the chat on the side of your screen. You can send messages privately to me. You can also send messages publicly to everyone on here. So just know that anything you put there, if it's not done privately, is seen by everyone. I'll be honest, the chat is a little hard to manage sometimes in conjunction with the questions and answers, just because there are two different tabs for my screen and I don't always see the chat questions in real time. But if you have a question, please submit to the questions and answers. We'll get to those near the end of the lecture, and those are always really fun. So, ask away. This is your time to have a forum to ask Dr. Park and Lori any specific questions you've been having about nutrition. So with no further ado, I'll let you guys take. Yeah.
One thing, can you remind people to mute if they?
Oh, yeah. Yes, please mute your mics. I can see. I can see all of you and which ones are not muted, and there's saying unmuted, although I will say the vast majority of you guys are muted. So please do mute if you are not already on mute. And I think otherwise that's good. Anything else, Stephanie? Nope. Okay. All right, ladies, go ahead. We've got 70 people here, so I think we have a good number of people to get started.
Okay. I am Lori Shell. I've been the dietitian here at RIMG for I just passed 9 years. So hopefully some of my former patients are on this call as well. And if anybody is interested in a virtual visit, or when the time comes to come into the office, I would love to help you with any needs you have. I'm going to go through a lot of the healthy eating habits that are for weight loss, but I also am going to go through some basics first about basic nutrition, and kind of clarify some of the myths about how we lose weight. I have this kind of famous mug here in my office that was made by a previous provider for me that says healthy eating is not equal to weight loss. So I do a lot of clarifications for people, although healthy eating has so many important factors in our diet and our well-being. It always is not the answer for weight loss by itself. So I'm going to go through some slides today and try to clarify some things. And if you have any questions, please do so at the end, and Dr. Tana will moderate that. So the objectives today, I'm going to go over what carbohydrates are, what proteins are, what fats are. So giving some clarifications with that, some common barriers to healthy eating, and also provide some tips and suggestions during this pandemic we're all in. So I've heard a lot of various concerns about the pandemic as far as making poor choices, lots of baking. We know people are having a hard time finding yeast in the grocery stores and some of their other regular inventory. So I'm going to go over some of how to plan ahead for that as well. And then we will see if you guys have any questions and answers at the end. So first, I'm going to go over what is a carbohydrate. I feel like in our current day and age, carbohydrates get a very, very terrible reputation. And I feel like I'm constantly clarifying people's thoughts and beliefs about carbohydrates. We know there are many diets, which I'm not going through specific diets today, maybe another day, but I know there's many diets that highly restrict or eliminate carbohydrates. And I always like to clarify with everybody that carbohydrates are a very important part of our diet. There is no need to eliminate them. Reduction is very helpful for weight loss, but no need to eliminate them. So carbohydrates are our primary fuel for energy. And most of the carbohydrates in the foods you eat are digested and then broken down into glucose before entering the bloodstream. They contain carbon, hydrogen, and oxygen. And now I'm going to talk a little bit about the simple versus the complex carbs. So simple carbohydrates are broken down quickly by the body to be used as energy. They're found naturally in our foods, such as fruits, milk, and milk products. And they are also found in processed and refined foods, such as candy, table sugar, syrup, and soft drinks. Complex carbohydrates, on the other hand, contain longer chains of sugar molecules versus simple carbohydrates. And because of the longer chains, they take longer to break down and they last longer in the body as energy versus simple carbohydrates. Some examples of complex carbohydrates are peas, beans, whole grains, quinoa, and acorn squash. An important concept to note is that the fiber found in many complex carbohydrates helps regulate blood sugars. So this is not only important for diabetics, but for everyone. I oftentimes get the question, is it okay if I eat more since I'm getting foods higher in fiber or are considered complex carbohydrates? And as I just mentioned, it is super helpful for slowing the rate of absorption of sugar into the bloodstream. So it does help blood sugar control for both diabetics and obviously non-diabetics. So that would help with reducing cravings and hunger. However, simple carbs and complex carbs per serving have very similar calorie levels. So I'm not going to go over what a serving size of each of those foods are. I do in a more individual visit. But just so you know, if you are trying to lose weight, it is not in anybody's best interest to increase complex carbs over simple carbs, because you would still have to take in all the calories from the non-fiber carbohydrates. So I just like to make that clarification for people so that they don't get the idea that they can eat more just because it has more fiber. But if you do like complex carbs, it is super beneficial as far as blood sugar control, and that's across the board. So a major take home, as I just said on this particular slide, is basically to try to increase your complex carbohydrates, but not your serving sizes, and to kind of go through what the difference is between the types of carbohydrates. I also want to make sure that everybody is aware that carbohydrates make up over 50% of our diet because of the three major food groups involved. So as I reviewed, starches, fruit, milk, or milk products. And I just want to make a clarification that beans do also have protein, a full serving of protein, and milk products also contain protein, but they do have a full serving of carbohydrates in them as well. So with that said, if 50% of our diet is made up of carbohydrates, then if we look at our diet as a whole to find out where we might overconsume calories when we're struggling to lose weight or we are putting on weight, we can probably take a good bet that it is from the overconsumption of carbohydrates. Overconsumption of calories is what leads to weight gain, not carbohydrates by themselves. So if we overconsume them, which is very easy to do, that is a contributor to weight gain. So it's important to know that carbohydrates aren't bad. They tend to acquire that reputation, but rather overconsumption of calories is what leads to weight challenges. And carbohydrates tend to be grossly overconsumed in many cultures, including the US and their diets and many countries in general. So keep in mind the starchy vegetables, peas, corn, potatoes, and acorn squash. And although beans and legumes are complex, they also contain a full serving of protein as well. Soluble fiber, just so you guys know, dissolves in water and the GI fluids when it enters the stomach and the intestines. And it is transformed into a gel-like substance, which is digested by bacteria in the large intestine, and that releases gases and a few calories. Insoluble fiber does not dissolve in water or GI fluids and remains more or less unchanged as it moves through the digestive tract. Because it is not digested at all, insoluble fiber is not a source of calories. So that's something to take into consideration when you have a significant source of fiber. That is why some people end up putting net carbs on a label, because they are deducting the total fiber from the total carbs. So next I'm going to talk about protein. So after water, protein is the most plentiful substance in our body. Your body uses protein to build and repair tissue. You also use protein to make enzymes, hormones, and other body chemicals. It is also an important building block of bones, muscles, cartilage, skin, and blood. And once protein is digested, it is broken down into its amino acids. Animal sources and dairy are the highest sources of protein per serving. With regards to weight, it is important to select primarily lean protein in order to minimize the amount of total fat and saturated fat, which would equate to higher calorie meats. So the thing I really highly stress when people are trying to watch their weight is to stick with lean protein. Some of that entails starting off your protein with no skin, and it is also best to avoid frying and breading your meats. Some examples of very lean and lean proteins include chicken breast, tuna fish and water, egg whites, cod, 1% cottage cheese, ham, turkey, roast beef, salmon, sardines in water, lean pork like center loin chop, USDA or select of choice grades of trimmed lean round sirloin and flank steak. So the take home from this slide really is to remember that lean protein is the second lowest caloric food group next to vegetables. And it doesn't contain carbohydrates. So anybody who is a diabetic or concerned about blood sugar control, protein acts as a really nice, what I like to refer to as a buffer. So in conjunction with your carbs to assist with lowering cravings, regulating blood sugars, and with satiety. Next up is fat. So as you can see on this slide, there are all different types of fats. There's avocados, there's nuts. Salmon, as long as is generally put into a leaner protein, at least I categorize it there. You can see some olive oil. And so basically, this is another big question I get about in my sessions is, what if I'm consuming the healthy fat versus the unhealthy fat? So as you might know, there's two types of fats, and I'm going to review those in a second. So the other group that tends to contribute excess calories to our diet is this fat group. This is mainly because it is more difficult to control and maintain accountability for. It is the most calorically dense of the macronutrients with 9 calories per gram. So that is more than 2 times as many carbohydrates and protein. So fat is the most calorically dense group, and it is the most difficult for most people to control because unlike carbohydrates that are very visual, and I like to give the example of when people eat out and they're able to avoid or substitute carbs, the other problem basically is fats. Once it's in a liquid form or a shredded form or a chopped form, it is very difficult to assess the quantity. So there are 2 main types of fat, unsaturated and saturated. And within unsaturated, it's broken down further into mono and polyunsaturated. But most people like to refer to the 2 types of fat as good versus bad. So good cholesterol is the unsaturated and bad cholesterol is the saturated. And as you might know, and I'm going to review in a little while, on labels, it is only required to put total fat and saturated fat, so you can assume what is not saturated would be unsaturated. So monounsaturated fats and polyunsaturated fats are known as the good fats because they are good for your heart, your cholesterol, and your overall health. These fats can help to lower the risk of heart disease and stroke, lower bad cholesterol, which is known as LDL. One tip I always give people is remember L, lower. So the lower the LDL, the better. H for higher when you get your cholesterol level. So the higher, the better. And it also can increase good cholesterol. Saturated fats is a fat that contains only saturated fatty acids. It is solid at room temperature and comes mainly from animal food products. Some examples of saturated fats are butter, lard, fatty meats, shortening, palm oil, and coconut oil. And saturated fat tends to raise the level of cholesterol in the blood. Some examples of monounsaturated fats are avocado, canola or olive oil, olives, nuts, and peanut butter. And polyunsaturated fats include mayonnaise, corn or safflower oil, seeds like pumpkin and sunflower seeds. And then saturated fats, butter, bacon, coconut, sour cream, cream cheese, and lard. So going back to the question I get a lot when I am counseling people for weight loss is why do I need to limit my fat intake if I only consume the unsaturated or the healthy fats? The big challenge, as I was mentioning to you earlier, is that our fats have more than 2 times as many calories per serving versus our carbs. So a way to kind of visualize it is about 10 almonds is kind of like having a slice of bread, a regular kind of thinner slice of bread. So the problem is that if we try to substitute our carbohydrates with healthy fats, but we eat too many, you are going to run into that overconsumption phase again of calories. And remember, it's not one particular group that contributes to weight gain. It's overconsumption of calories. So therefore, we want to make sure that we limit our fats as well, even our good fats, and you can receive all of your nutrients required in your good fats from smaller amounts. That's another question I get is, don't I need good fats? But you would be getting them naturally in some of your foods. Our starches have natural fats in them. A lot of it have a little bit of fat in them. Our lean proteins have some fat. Our fish has some fat. So you would be getting your omega-3s from the small amounts you were eating anyway in the other forms. The other thing is our belly does not know the difference in calories between the good and the bad fat. Our arteries do. So it's really helpful for somebody who might be a normal body weight or in a decent body weight range, but they have a high cholesterol to start to pay attention to the good versus the bad fats in their diet. If you are overweight, it is still recommended that we overall decrease fat intake and that the fats you do consume are mainly unsaturated. So just to recap the bullets, that body's fuel source, major storage form of energy. Moderate amount is needed in the diet for good health. And our 3 types of fats basically are saturated, mono, and polyunsaturated. Okay, this is another big one that I've been so excited to use virtually with people at home as they are going into their kitchens and they are pulling out their labels. And we are looking at their actual foods they're consuming together. This has actually been happening quite a bit when we talk about something and they'll say, is this good? Is this bad? Is this too high in carbs? Is this good in the bad fat? So I will ask them to go grab it from their kitchen. And the virtual visits have been going very well. So this is a hot topic. Actually, Dr. Tano had asked that I put this into the presentation. I don't know if some of you have already been starting to see the new labels, but as of 2021, it should be on every label is this new label. And the labels are very confusing. So I just want to review, there are really only 4 main things that are going to be changed on this label. The first thing, as you can see, is the serving size now appears in a larger, bold font. And some serving sizes have been updated to be more consistent with what we eat. So oftentimes you might look at a label and you might, for example, see 2/3 of a cup as shown here. I'm not sure exactly what this label represents, but or a cereal label. And let's be honest, most people don't eat strictly 1/3 or 2/3 of a cup of something. So I think they were also trying to change that to be more accurate with serving sizes nowadays.
Hey, Lori.
Yes.
Lori, I think you should be able to use your little arrow, your cursor, to show people.
Oh, okay.
Okay, go ahead.
Okay. So you can see here the original label has the same serving size, but you can see here that it's now in bold. And the really big challenge, which I don't really like, is that they put things also in grams. I don't think very many people weigh their foods. And if I'm not mistaken, there is about 28 point something grams in an ounce. So that's kind of how you have to figure out it in ounces if you wanted to use the scale in ounces. But so they now put this in bold and they're trying to make that, I guess, more realistic, maybe in other labels. I'd have to look at the various labels. And then you can also see here that the calories are also now in bold. If you look at the original label where this says calories from fat, it is very difficult for the average person to understand what that really means. Other than 72 of the calories out of 230 are coming from fat. But basically what you would have to do is you could take this fat number here, times it by 9, remember, because there's 9 calories per gram, and that gives you that number. But it's not very useful for a lot of people, so I am guessing that they took that off. And then as you can see down here, they've also changed the daily values. They're updated also to be more reflective of what we're consuming nowadays. So you can see over here that didn't change. They still put it in percentages. This is also something that is very confusing. I had it yesterday from a patient. When I asked her to read me the grams of something, she looked right over here at these percentages, and I always know when they're reading from the wrong side. That percent daily value, and you can see on the bottom, is they've also changed how they describe it. But what that is supposed to say is if you were following a 2,000 calorie diet, or on the old label it said a 2,500 calorie diet, this is what it would provide for you. This product in this serving size provides you, for example, 10% of total fat that you need for the day. I just don't think it's very useful because most of my patients don't count calories, and I don't generally use counting calories as a tool for weight loss. So, but it's nobody understands really what the use of that is. So that's basically what it's saying is if you're eating a 2,000 calorie diet and you consume 1 serving of this product in 2/3 of a cup, that is meeting 10% of your recommendations for total fat for the day. So those are kind of the biggest things is on the labels. I went through the daily values, and you can also see here the difference, the total carbs is the same, fiber is the same, sugars. So now they've also put it in added sugars. So that's kind of thinking as if you took table sugar, sucrose, and put it into a food item. That's what that is. And again, it gives you a percentage of a daily value. So as you also might want to know, you see this total carbs here. That's what I help people pay attention to when they're diabetic or trying to lose weight, is how many carbs they're taking in. Because there are many, many carbohydrates. And as you can see in the old label, if we added 4, which is coming from fiber, and 1 coming from sugar, so then there's another 33 grams of carbohydrate that aren't even listed here. It is very common for people to just pay attention to the sugar, but there are other carbohydrates outside of fiber that are contributing calories to this product. Okay, so I think I covered most of the label. Oh, let me just go over a little bit also. The lows and highs of the percent daily value, which is down here. So the percent daily value shows how much a nutrient in a serving of food contributes to a total daily diet. Daily values for nutrients have been updated, which may make the percent daily value higher or lower on the new nutrition facts label. As a general guide, about 5% of the daily value or less of a nutrient per serving is considered low. 20% or more of a nutrient per serving is considered high. And this footnote down here has been updated to better explain that. So just so you know what is no longer required on the label, calories from fat has been removed because research shows the type of fat consumed is more important than the amount. Vitamin A and C are no longer required on the label since deficiencies of these vitamins are rare today. And these nutrients can be included on a voluntary basis, which is actually the fact with many things. You'll see people still putting trans fats on a label. They've been banned. So they should always show up as a 0. Also, sometimes manufacturers like to put polyunsaturated or monounsaturated on their labels as well. So that sometimes you'll see also. So they can vary. There's just certain requirements. Some of the others are voluntary. Okay, so just to go over added sugars and how they're different from total sugars is that I just mentioned earlier that total sugars is naturally present in many nutritious foods and beverages, such as sugar in milk and fruit, as well as any added sugars that may be present in the product. No daily reference value has been established for total sugars because no recommendation has been made for the total amount to eat in a day. So I sometimes tell people if you had a piece of fruit that happened to be labeled and you were to look under total carbohydrates and then underneath see sugar, just about 100% of that total carbs would be coming from sugar because it's naturally found in there. Added sugars on the nutrition facts label include sugars that are added during the processing of foods, such as sucrose or dextrose. Foods packaged as sweeteners, such as table sugar, sugars from syrups and honey, and sugars from concentrated fruit or vegetable juices. Diets high in calories from added sugars can make it difficult to meet daily recommended levels of important nutrients while staying within calorie limits. So having the word includes before added sugars right here indicates that added sugars are included in the number of grams of total sugars in the product. Okay, I think that I did most of the labels. Oh, and just so you know, more often choose foods that are higher in percent daily value for fiber, vitamin D, calcium, iron, and potassium. And lower in percent daily value for saturated fat, sodium, and added sugar. So even if you're not following, per se, a 2,000 calorie diet, this is a really good tool to kind of see if it's high or low in something. Okay, so this is the sample picture from myplate.gov. And the purpose of My Plate is to promote messages based on the 2010, pretty old, I know, Dietary Guidelines for Americans. My plate emphasizes 5 food groups: fruits, vegetables, grains, protein, and dairy. Consuming balanced each of these food groups as recommended in my plate helps build and maintain healthy bones. It's a helpful tool for people to envision how their plate should look, but because fruit is considered a carbohydrate, when I am educating people, I personally like to assist them with decreasing the calories to promote weight loss, as well as help diabetics or pre-diabetics control their blood sugars. So I tend to put this fruit and this grain together. And I don't have a picture of it, but basically what I like to do is have about, I wrote down on the bottom here, to have 75% of the plate made up of lean protein and vegetables and about 25% made up of carbohydrates, and preferably whole grain carbohydrates. So I basically would probably put these two together and put this vegetable and protein up about here. Okay. All right, and now I'm gonna send it over to Stephanie for a little bit. Thanks for joining me, Steph.
Hi.
Hi.
All right. Thank you everyone for listening in and spending your Wednesday afternoon here. So I'm going to be talking about some common barriers to healthy eating. Now, I know that this could be a whole presentation unto itself and then some, because when it comes to healthy eating, by and large, knowing what to eat, in my opinion at least, is the easy part. Most people know that eating a salad with grilled chicken breast is going to be more nutritious than a Big Mac with a side of fries. But the hard part is, how do you make that healthy choice when there are so many factors that get in the way? You know, in working with people on their lifestyle goals, the ones I hear most commonly are, time and convenience. People say, when I have so many other things to do, going grocery shopping, patting dry this nasty raw chicken, chopping up my vegetables, it's just not a priority. It takes too long, not to mention the cleanup afterwards. And then you have just food preference. If only that Krispy Kreme didn't taste so darn good, it would be so much easier. Another major barrier is cost as well. That buying fresh produce, good proteins can be pricey, especially if you try to buy organic. Fast food, microwave dinners can be less expensive many times. I also wanted to point out that there are some sociocultural factors at play, and including things like family influences. Growing up, my parents always told me that, I needed to finish all of the food on my plate. Even if I left just a few grains of rice, it would mean that my future spouse would have marks and pimples on his face. And did I believe this? No, I did not. But the message was still there. Don't waste any food, eat it all, even if you're already full. And I think this contributes to the overall problem we have, that when it comes to eating, we don't really listen to our bodies. We eat when we're not hungry, and we don't stop when we're full. So those are some of the major barriers that we come across. But what I wanted to focus on today, and Lori, you can go to the next slide, is stress. We've all heard of stress eating, emotional eating, whatever you want to call it. We've been there, done that, but why? Part of it is physiological. So when there is an acute stressor in your life, something that's short-term, like a big job interview, or maybe you had a big fight with your sister, your appetite can temporarily decrease. You might feel even nauseous at the idea of food. This is because short-term stress triggers the sympathetic branch of our autonomic nervous system. Bunch of words, what it pretty much means is our fight or flight. So this is when you feel stressed or anxious, and you notice some physical symptoms, right? So your heart beats faster, you might feel hot, sweaty, your breathing increases, and this is an evolutionarily adaptive response. When a caveman encountered a bear, he needed a way for his body to quickly mobilize to either face the threat head on or hightail it out of there. So this sympathetic arousal triggers a release of epinephrine or adrenaline, and puts the kibosh on your appetite. Who has time to eat and digest when they're running away from an angry bear? But stress that persists, what we call chronic stress, actually does the opposite, has the opposite effect of increasing your appetite. Because this chronic stress is associated with cortisol. This is the stress of being in an unhappy job, of having an adult child whom you're always worried about. And this is where that emotional or stress eating really comes into play. Research has shown that physical or emotional distress actually affects our food preferences. We can tend to crave the sweet, salty, fatty stuff. They're called comfort foods for a reason. Having that slice of chocolate cake releases dopamine in our brain that affects the brain's reward circuitry. So, imagine if I handed you a stack of $100 bills, that dopaminergic mesolimbal system in your brain would light up like a Christmas tree. And the same thing happens when you taste that chocolate. It's really rewarding. It feels good. And food is quite literally that reward when you're stressed out and your brain has been otherwise starved of happiness. Something else to mention is binge eating. So this is a phrase that gets thrown around a lot, but actually refers to a pretty specific condition. What is binge eating disorder? So binge eating disorder is when someone has recurrent episodes of eating large amounts of food in a short amount of time. So, I'm not talking about having an extra helping at Thanksgiving dinner. Binge eating episodes are characteristically associated with eating until you are uncomfortably full, oftentimes eating alone in privacy, and there's a deep sense of shame or embarrassment about binge eating. People who binge eat really report that they feel a complete lack of control when it comes to, the behavior. They feel terrible about it afterwards, and feel angry with themselves, feel depressed, and you can see how this really feeds back into the cycle. And I wanted to mention this today because binge eating disorder is really quite underdiagnosed and undertreated, and as you can imagine, there's a real stigma to it. So, oftentimes even people's immediate family, their spouses are unaware. So if what I've described seems to apply to you, I encourage you to speak to your physician about it, certainly reach out to a mental health professional, and there are treatments that can help. Lastly, I also wanted to point out that last bullet point that there are other factors associated with stress, such as, when you're stressed out, you're not sleeping well. Oftentimes you're not exercising, you're using more alcohol, and these all certainly contribute to weight gain. So kind of the overall message here is that it's really an interplay of the physiological, the emotional, the psychological variables that affect stress and eating.
I guess it's back to me. So I don't know if any of you guys have seen this meme, but basically this has been going around the web kind of to show people that gaining weight in college was called the freshman 15. And this time it'll be the quarantine 15. So, we were hoping our discussion today, at the very least, would help people to take a bit of control of their diet and also their well-being, and try at the very least to maybe maintain their weight. Some people I have talked to are doing an excellent job with actually continuing to reach their goals of weight loss. And if anybody is in the category of potentially gaining any weight, it's really not the time to worry so much. There's so many variables playing a role right now, and the time will come when you will be able to take that back off again. So one of the main points of the discussion today was also to help give people tips while they are going through this quarantine life. Okay, so one of the things that I've been doing is making a grocery list to make sure that you minimize the time at the store. And if you are doing delivery and you're lucky enough to get a delivery time, That's also good, but I've heard some a little bit of stressors there too. So you might want to consider ahead of time, if you are ordering delivery, whether you have any substitutes in mind for things that are not in stock, or whether you'd prefer to skip over it for the delivery. But when I've been going to the store, I've been making a list in advance. You can either do it on your phone or preferably write it down. And also, if you are doing delivery or you're minimizing the time at the store, keep in mind that you might want to shop for several weeks at a time if you do have the room available at home. I know a lot of people do not have second freezers or refrigerators, limiting their storage space. But if you do have that option, that's helpful as well to just plan for a few weeks at a time. Buy food items with a longer shelf life. So carrots, sweet potatoes, beans, quinoa, canned tuna, canned sardines, things like that. And also it helps if you have many people in your house and you do buy in bulk, you can divide the family packs into smaller ones, more manageable portions, and then you can freeze it. So if you are able to get some meats in advance and they come in the family packs or the large packs, you can certainly make it into smaller and do several different meals with that. And then maybe even come up with a meal plan. Look at what you have available, make some healthy snack and have them, there we go, and have them readily available. So one concern that I hear over and over is lack of time. This is generally before the quarantine life, is that people found that they did not have time to do all of these lists above. Prepare their meals, cut up and wash their vegetables. And so now's a really good time to take advantage, and you can, and oftentimes realize that some of this stuff doesn't even take that much time. So this is a great time to start to do something this, and hopefully it will carry over these habits when we get out of the quarantine life. So also you can do things like roast your vegetables in advance and freeze them. So if some of your produce is starting to get a little bit icky, you can go ahead and do that. Cut up your fresh fruit and vegetables and have them readily accessible. I always find that when there are things cut up in my refrigerator at home, that my kids do take them out more quickly than if it's just sitting in the produce bin. And then also I tell people, when you turn on your grill, and it's such a beautiful day today, so hopefully everybody will get outside for a little vitamin D. When you turn on your grill, don't just make 1 or 2 chicken breasts for the few in your house, but make extra. So make 4 or 5 chicken breasts, or considering putting a flank steak on, or a piece of salmon, or some kebabs. So you can make more for leftovers. And really try, when you go to the store, to focus on getting those lean proteins. They are super helpful for satiety and also to decrease your cravings. So again, if you can picture that plate, that portion plate, where you want to really focus on having about 75% or so proteins, lean proteins and vegetables. Make enough for leftovers. A lot of people are using the extra time to play around with some new recipes. So this would be a good time to hone in on your cooking skills. And another thing that's very helpful is to eat at consistent times. I hear a lot of people are very much off schedule. There's a lot of insomnia. The kids are off schedule with their school. They're going to bed really late, waking up really late. It's kind of affecting everybody in the household. But one thing that really helps to keep your cravings down is to eat every 3 to 4 hours. It doesn't have to be a meal, but it's very helpful to do that consistently to help, again, regulate blood sugars. This is with or without diabetes, in order to help keep your satiety down and your cravings. And in the ideal world, if you can also include in those snacks some lean protein, that also is helpful. If you wanted to use any smaller plates or bowls, and then again, you might want to take your food and put it on your plate beforehand. Stay hydrated, lots of water.
Lori, can I jump in?
Go through this one?
Yes. The point about using smaller plates and bowls is because research has actually shown that when people use smaller plates, they put less on their plates and they consume less. And this is an unconscious thing. So whether it's what you're using for your snacks or your dinner, try using a smaller plate, a smaller salad plate versus a bigger dinner plate.
And do you want to go over the last bullet, Stephanie?
Sure. Portioning your food before you start eating instead of serving family style. That way you sort of, can know in advance the proportions of what you're serving yourself, and you're not getting second, third, fourth helpings. And, it's more effort to walk up back into the kitchen. And these smaller behavioral things can add up and make a difference. Staying hydrated is important. Oftentimes people, when they think that they're hungry, it's actually because they're dehydrated. And so getting enough water and fluids can be helpful. Awareness. So this is a big thing as well. I alluded to this before in terms of, being able to really listen and hone in on our body cues of when we're actually hungry. Because so many of the people that I work with, we talk about that, I eat even when I'm not hungry, right? I eat because I'm anxious or stressed. I eat because I'm bored. I eat even when I'm happy. You think about our culture, so much of any type of holiday celebration, anytime you go out with your friends, coworkers, everything revolves around food and eating. And so, being able to work on awareness of why you're eating and whether it's for another reason, and how can you meet that need, whether it's, to feel less stressed or to celebrate without using food. And then multitasking when eating, and then sort of, related to the last bullet point. And oftentimes we eat when we are on our phones, we're doing work, we're watching TV, and this contributes to a lot of mindless eating when we don't even realize what we're putting into our mouth and how much. Yeah, stress management does the body good.
Okay, so I just want to kind of sum up again how you want to really look at your plate and think about your meal planning and your menus during the quarantine life, and actually hopefully rolling over into the non-quarantine life as well at some point. So lean protein is probably one of the most important to keep in your house during these challenging times, since it helps a great deal with decreasing hunger and cravings while providing the second least amount of calories per serving after your vegetables. So lean protein, for those that eat it, and the protein-rich foods are things like eggs and yogurt. And for those, eggs and yogurt for people that don't eat meat. Otherwise, it's basically meat products. And the leaner, the better, since the high-fat meats like rib meat and processed meats like hot dogs and bologna and salami, they have a higher calorie content, and also very high in the saturated fat, which is that bad fat. So also another thing you might want to try to do during this time is get variety and color into your meals. So things like sweet potatoes and spinach and kale and red and green and yellow and orange peppers and tomatoes, radishes, broccoli, corn, and carrots. And basically, you can see on the bottom, for a lot of my patients have come to see me, they ultimately remember this little tip. If there's one thing they remember, is this PVC. It helps them to remember to pick their protein first, then their vegetables, and then a smaller serving of the carbs. Here are some sample snacks. Egg white salad, celery or apple with peanut butter, cottage cheese with blueberries, lettuce wraps with lean protein, vegetables with a lower fat hummus or dip, tuna fish on a rice cracker or over a bed of lettuce, plain Greek yogurt with a product called PB2. For anyone who hasn't seen that, it is a powdered peanut butter. Most of the grocery stores sell that, or they sometimes flavor that plain Greek yogurt with an extract. And another one of my favorites is smoked salmon on cucumber slices with cottage cheese or without. As you can see on this list, there is either a carbohydrate with a protein, lean protein, or a carbohydrate with an unsaturated fat. And then sometimes there's just basically protein with vegetables, and that's okay once in a while too. I just wanted to also say for anybody who's struggling with what stores to go to, because I know everybody's minimizing their trips. I find that Trader Joe's has a lot of great varieties for lower fat dips. If you go to their homemade dip section, they have a lower fat hummus, a spinach and kale dip. And also they have a lower fat guacamole, and these are usually based with a fat-free Greek yogurt as their base. And another place that I also find that has a great abundance of produce is Aldi's. They tend to have really good prices, and I find that their produce does last equally to other stores as well. So if you or anybody you know needs any further support from either Stephanie or myself as a registered dietitian, I also help to look at you as a whole with any medical conditions you have and or medications you're on. So I will look also at your blood work and help you manage cholesterol, diabetes, triglycerides, hypertension, kidney disease, celiac disease, irritable bowel, inflammatory bowel. So anything that I can assist with, I can help you with. We could work together to develop an appropriate meal plan. Hold on one second. And then before I let you go, Steph, I just wanted to let anybody know if you want to, or if you're curious about insurance coverage, the insurance companies do cover nutrition. Almost all the insurance covers nutrition consults, and depending on the insurance, they usually cover anywhere from 4 visits per calendar year, anywhere up to 26 visits per calendar year. And some of those visits, depending on the insurance, can even be covered for healthy eating. So if you just felt like you didn't have the best of habits. So if you have any questions about coverage, you can message me in the portal if you use our portal, or you can call our main number still, and they will send me a message as well, and I can give you a call back. Otherwise, you're up, Steph.
Yeah, so I'm also available for consultation to help work on healthy lifestyle goals, whether it's healthy eating or other behavior change, like you'd like to drink less alcohol, you would like to stop smoking. So we're available for that. Of course, addressing any underlying factors, whether it's stress, anxiety, depression, family issues, and mindfulness training. So I certainly want to leave enough time to answer questions that have come up. Dr. Tano?
Okay. Actually, you guys did a really thorough job, and you answered to some degree, at least most of the questions we had. And since we just have like a minute or two, I think the few that you didn't quite get to, I'm not sure that we have time for, but there was one question that I think is an interesting one, maybe a little bit more for Lori, and maybe this will just be our last question. But just as a reminder, just quickly before we go through the question, you know, Dr. Park and Lori are available for virtual visits during this time we're closed. We all have open schedules. I know it's counterintuitive. You think we're so busy during this COVID crisis, but truthfully, we have more time than usual. Yeah, so please go ahead, schedule with one of them or your primary care doctor. We're available. And then just reminder, there's a lecture coming up on Friday for those of you guys who enjoyed today's. And Friday's lecture is going to be on starting a behavior exercise program at home. So just quick one, this last question, how much do genetics play a role in nutrition and diet? I get this a lot with, you know, I've always been this way, or this is how, you know, my family. So Lori, maybe this question a lot, and maybe you can speak to that.
Sure. So I do get that a lot as well, obviously. There's many times, especially people who come in, I actually had this yesterday, where you get somebody whose BMI is pretty normal, barely overweight, new diabetic, elevated cholesterol. So there's not a, you know, or feels like they eat a very healthy diet. So what I try to explain to the patients is that genetics do play a fairly big role. A lot of times with the younger people who are developing type 2 diabetes, who are not terribly obese, since obesity is the #1 risk factor for type 2 diabetes. If they come in and they're not terribly overweight, but they're a new diabetic, I usually ask them if they have a family history of it. Oftentimes the answer is yes, and occasionally it's not. Same thing goes with cholesterol. And oftentimes what I'll do with them is I'm going to educate them specifically on the diet for diabetes or cholesterol. And I will explain to them that by following these diets and making the correct modifications, we will able to better assess what role or what % impact does the diet have on your particular lab, you know, on your particular lab, so to speak, with cholesterol and stuff. So genetics does play a large role, but I am also fairly convinced that some of it, if not a majority of it, can be improved through dietary changes. But there are people who I have had that have changed everything and still continue with elevated cholesterol, because our bodies make cholesterol. So it's not only coming in from your foods. But the bigger thing that I like to tell people, another take-home message, is saturated fat generally actually impacts your cholesterol levels more than cholesterol itself. So it's important to look at your carbohydrate labels that do contain fat in them, in addition to eliminating your fatty meats. And those also play a huge role in people's cholesterol levels, more than just cholesterol itself. They start to look at things like bars or granola bars or prepackaged foods and realize their saturated fat intake is quite high. So it's a combination of both, but it's always worth trying diet. I always say it can't change to hurt your, it can't hurt to change your diet and see what kind of outcomes you get. Usually the doctors are so willing to repeat blood work in a couple of months to see, you know, where their numbers have gone to.
All right. Thank you to our speakers, Lori Shell and Dr. Park. If you have specific questions about your diet, feel free to schedule with either of them. Oh, just a quick question here, Lori. Do you work with out-of-state patients?
Yes. Yes. Mm-hmm.
Okay. Yeah. So
also, you don't have to be, and I think this also, I think applies for Stephanie. You don't have to have a internist at RIMG to see one of us. You do the same, Stephanie?
Yes, yes,
okay,
yes.
So we will take outside, you know, if you've been with an internist for a really long time who's not at RIMG, you're still more than welcome to see any of our specialists. Actually, I think all of them take patients, even if your internist is not here. But if you have any further questions, but yes, we do take out, a lot of people have out-of-state insurances. They work for international companies or for the embassies and things like that. So
yeah. So you guys have additional.
Did Dr. Cowan put up something real quickly? I think she had a question. Did you see anything?
I don't see anything from Dr. Cowan. There's
Okay.
questions about how to get in touch with us. I think, you know, you can feel free to message your primary care provider if you have questions about some of the logistics. Feel free to message either Lori or Dr. Park specifically if you have questions. But otherwise, you know, you would call and schedule a regular visit and then go from there. Somebody usually will, you know, just send your messages to the group through the portal and they'll get filtered to the right person. So
hold on really quickly. I did get her message. It was, she sent it to me. She just wanted to know if maybe some people on the call, whether obesity itself is also a large genetic role. And of course, I think a big part of the obesity part is, yes, there are some genetic components, but I think also a lot of it is developed from the way you're raised and the foods that you're, you know, fed growing up. So you do have a large impact on changing that as well as you get older. So even if you come from a family tree of very heavy or obese family members, you still can do a lot to lose weight and also improve any of your cholesterol levels. I have had people who went from full-blown diabetes to really wonderful numbers just through diet and weight loss alone. But I think a lot of that is basically, you know, how you're raised as far as what your food choices are and you know, maybe if you're eating high calorie from restaurants or carry out. So even if you come from a family history of overweight or obese relatives, you certainly do not have to remain obese. If you come into my office, you will certainly lose some weight.
all right, thanks guys. These slides will be posted on the RIMG website under the COVID webinars. We're also posting the actual video recording of it. Those will go up on YouTube at some point. We're still working on some of the logistics of that. but the slides themselves we can post online. So if you had questions about specific, items that were on these graphics, because they were very helpful. But thanks again for tuning in. Let us know if you want to meet with any of our providers or doctors or really anyone at the practice. We're happy to help you, especially during this time. But thanks again. I'm Dr. Tano, and hopefully I'll see some of you guys back on Friday. All right. Thanks.
Bye-bye. Stay well, everybody.